Chemotherapy drugs can be given in many different ways, and the method in which you receive chemotherapy is dependent on the drug used to treat the type of cancer you have. It may be that you need to be given a combination of chemotherapy drugs, and these could be given to you differently. For example, through a course of tablets taken at home, as well as injections that will be given to you in a hospital or daycare unit. The most common methods for receiving chemotherapy are intravenous injections and oral medication. We will discuss intravenous administration in a separate video, as there are a number of methods that may be used to give your specific medication. Oral chemotherapy drugs are swallowed and come in the form of tablets, capsules and liquids. These drugs are typically absorbed by the stomach. However, not all chemotherapy medication can be given orally, as many are broken down or degraded in the digestive system. It is common for a course of these to be taken at home, with regular checkups in your local hospital. You may need to take your chemotherapy tablets at specific times, and you will be told when this is, and whether or not your medication can be taken with or without food. It is very important to take your medication on schedule in order to achieve the best possible result from the treatment. If you do not take your medication on schedule, or you miss doses, then its benefits may be reduced. But if you do miss a dose, contact your nurse or pharmacist, because if you try to rectify this by taking more than the specified amount, it can increase the risk and severity of side effects. You will need to know and understand what to do when you miss a dose. Usually, you do not take a missed dose, so please check with your treatment team. Your medication may also need to be stored in a special way, such as in the fridge or in the dark. Again, it is important to follow the instructions given by your nurse or pharmacist. Chemotherapy can also be given as injections. Again, the type of injection and their frequency will depend on the particular chemotherapy used to treat your cancer. Such injections may be given under the skin and are known as subcutaneous injections. Here, the skin of the abdomen, thigh or upper arms are the most common areas for injections. It is possible that you, a partner or family member can give these subcutaneous injections, all in the comfort of your own home. If this is feasible, then a nurse will give training and ensure that you or others are comfortable and proficient in giving such injections. Other routes that can be used by your nurses or doctors include intramuscular injections, where the drug is injected directly into muscles, injections into body cavities, intracavitary injection, such as the bladder, and intrathecal injections, where the drug is injected into fluid around the spine and brain. In rare circumstances, some drugs are given into an artery, but this is highly specialised and uncommon. Finally, for some conditions, you may be given topical chemotherapy. Here, the drug comes as a cream or ointment, which is rubbed onto the skin directly.